Hello, everyone, and welcome to today's live broadcast, Designing Enrichment in Husbandry to Enhance Translation, presented by our keynote speaker, Dr. Melanie Graham. We are excited to bring you this educational web seminar presented by LabRoots, the leading scientific social networking website and provider of virtual events and webinars, advancing scientific collaboration and learning. For more information, please go to labroots.com. I'm Christina Jewell of LabRoots, and I'll be your moderator for today's event. Before we begin, I would like to remind everyone that this event is interactive, and we encourage you to participate by submitting as many questions as you want at any time you want during the presentation. Just click on the green Q&A button located at the lower left of the presentation window and type your question into the box that appears on the screen. We'll answer as many questions as we have time for at the end of the presentation. Also, please notice that you will be viewing the presentation in the slide window. To enlarge the window, just click on the screen icon located in the lower right. If you have trouble seeing or hearing the presentation, please click on the support button at the top right of your presentation window, or use the Q&A box just to let us know that you're having a problem. Now I'd like to introduce our keynote speaker, Dr. Melanie Graham. Dr. Graham is an associate professor in the Department of Surgery and Veterinary Population Medicine. Dr. Graham is also the director of the Preclinical Research Center, PCRC, at the University of Minnesota. She earned her MPH in epidemiology from the University of Minnesota and her PhD from Utrecht University. Her research is centered on the development of cell-based therapies for the treatment of diabetes, specifically extrahepatic delivery of islets. Dr. Graham is also widely recognized for her expertise in the characterization and refinement of animal models of chronic disease to enhance translation to the clinic. This work proved pivotal to the first demonstration of successful long-term diabetes reversal after adult pig islet xenotransplant in non-human primates. Dr. Graham is serving on the North American 3Rs Consortium Steering Committee, the NIAID Non-Human Primate Transplantation Tolerance Cooperative, and the NIAID Immunobiology of Xenotransplantation Cooperative Research Program. Her research is supported by the state of Minnesota, JDRF, and NIH. Please join me in welcoming Dr. Melanie Graham. Dr. Graham?
Christina, thank you so much for that fantastic introduction. I am just absolutely thrilled to be a part of the LabRoots series. It's a great honor to be with all of you today, and I'm really enthusiastic to share some of the work that we've done at the University of Minnesota in the hopes that the crowd that's watching will realize some of the benefits that we've been so enthusiastic about over the years. So what I was hoping for today is to take you through, if I can get my slides going here. See, we're going to talk quite a lot about behavior today, and one of the things you're going to see is how my behavior evolves over using this really interesting LabRoots technology. So one of the things that I really wanted to do today is talk very pragmatically about what we do, and to talk about how some of these techniques, as we've employed them here at Minnesota, have both improved animal well-being and really enhanced the predictive value of some of these animal disease models that we work with. And I think it's always good to go back whenever we're talking about animals and how they're used in research to really think about the number of ways in which they've contributed, including how we understand how they, again, have contributed to these various models that you see down the side, how diseases are affecting living tissue, how we develop prevention and treatment strategies, and really how we use our animals to train future scientists and healthcare professionals. And I think that again, the reason I raise this is because we often rely on what society thinks of our animal use in research. And currently, of course, that's accepted by the majority of society. But this really relies on an underlying basis that we all need to be aware of as folks who use animals and investigators who continue to rely on them in our research. The intrinsic basis of biomedical research is aimed at doing good for animals, for humans, for the environment, and society. And so again, that basis really revolves around utilitarianism, and that's at its core. But as we've used animals over the years, we really see this view evolving into what we call a hybrid view, and that accepts another perspective, which is the animal rights view, that at the same time we have to have a certain accepted level of welfare for our animals, guaranteed, irrespective of the benefit to those things that we talk about above. And so this developed into what most of us are quite familiar with when we think about submitting anything to our IACUCs, or we think about, again, sort of these ethical review boards across the world, is harm-benefit analysis. And that really is something that we have to think about as we put together our applications. Most of us as investigators think that the importance of our research is very high. As Christina mentioned, I'm a diabetes investigator. And so I look at the millions of patients that are waiting for us to come up with a really valuable cure. And I think that it sits quite high on that scale that you see on the right. And when we talk about likelihood of benefit, that's a really interesting one for investigators, I think, because again, most of us like to think that as we design these experiments that the likelihood of benefit is of course going to be quite high. But in particular today, we're really focusing on disease models, and I think the shift is quite high because when you're working in a disease model, you're at that translational sort of boundary where you're doing quite a lot of safety and efficacy with the remark typically that you're ready to move it into the patient. It's a little bit more difficult for our basic scientists when they look at this model because they're maybe earlier along the pipeline towards translation. Probably where we have the most ability to impact as we talk about enrichment, and the focus of our talk today is when we talk about animal suffering. And disease models really introduce some unique variables to that versus observational studies or simpler studies that are short or acute. When we talk about disease models, we're imposing a level of suffering by design, by inducing disease. So I like to talk quite a bit about how the 3 R's, which of course are replacement, reduction, and refinement, to actually shift that balance. And I think one of the things that we really need to look at as investigators always is reducing harm on animals incurred on the study, but of course we can do this in a way that really incorporates our scientific needs. And I'm going to talk a little bit about validity, to how we use validity in our models to bring actually this closer to what we see in our clinical patient situation. And you know, I think that when you talk about the 3 R's and you bring it really close to the science, this is how you really engage scientists in a meaningful way. And everyone wants what they're doing in their models to really be predictive, as that's sort of our ultimate goal of how good are these models. So when we talk about validity and why it matters, I think, as I mentioned, the real goal for our preclinical models is that we want to bridge that basic research into our clinical therapeutics. And there's been some really interesting papers that have come to the literature recently that have really criticized preclinical work, and especially our evaluation in animal models. And I think probably the one that people have really brought to the forefront is that the proportion of therapies advancing to approval is quite low. Now, again, I think as investigators, we look at this and we say, I know for me, if 10% of what I was working on when I'm working on cures for diabetes came to the clinic, I'd be quite pleased with that. But I think, again, it's really about looking at how again, the lay public is reading this and the drug pipeline. That number, of course, everyone would like to be higher. And there's certainly a number of factors outside of the animal models themselves that impact this. But I think it's okay, and I think it's actually quite useful to ask, are our approaches to translational research really fully sound? And what are things that we can do that take a look at really improving these models over time? So one of the things that I wanted to talk a little bit about today is behavioral management and enrichment and how it relates to validity. So most of you have probably been introduced to this idea of validity. And I think because, again, a little bit of how the field has evolved, people don't like to talk very much about the limitations of animal models because they're a little bit fearful that when that conversation comes up, then it will open up the question to, well, why do we use animal models at all? But I think it's really important as we talk to our colleagues, as we talk to regulators, as we talk to, again, the lay public, that we are really straightforward about what are the applications for our research and the limitations of our research as we use these various models. So we look at 3 different types of validity when it comes to external validity typically, which is face validity. So does the symptom manifestation in the model really similar to the clinical condition? We look at construct validity. How does the underlying biology in the model match to the human clinical situation? And as I mentioned, sort of the holy grail, predictive validity. Do we see a similar response to what we see has worked in the clinic when we use animal models? And that's been something that I've felt really fortunate as a transplant investigator. Our models in transplantation are extremely predictive to what we see in the clinic. So it's quite easy to have that conversation. One of the things that I think is really worth having a discussion about, and this again really brings in this aspect of enrichment and behavior, is how do we bring our animal trials closer to the clinic? So as you can see, I threw up some of our common disease models that we work with. And the thing to kind of have a look to here is that these patient populations, when you look in the literature, are some of our patients that report the lowest quality of life resulting from their disease state. And I think as we talk about quality of life, you could easily essentially replace that word in the animal world with welfare. So as we talk about when we're bringing our animal trials closer to clinical trials, when you have this very representative animal model of disease, this has really tremendous welfare implications for our animals. And I think that the other thing to really keep in mind is that when you have animals in a disease state, you add tremendous pressure to an already difficult, potentially, captive management program. So I think it's important to talk about sort of the special considerations that revolve around, as I mentioned, when we look at the sort of cube of how we're looking at harm benefit, how introducing disease burden really affects animal suffering. So of course the chronic disease state is typical for most of the diseases that you saw. And of course, our interventions are not perfect, or we wouldn't be doing this research in the first place. So we really see that impact welfare in the same way that we see, again, in the patient situation. So how can we have, again, our animals adhere to treatment regimens, the restrictions that we have that they may have to, again, be subject to. This can lead to a lot of issues with anxiety and, of course, inhibits typical coping mechanisms. The other thing that we need to remind ourselves when you have animals bearing a disease burden is, of course, the dependence on caregivers. So how can we use the tools that we might have via enrichment or behavioral management to affect their perception over their treatment control? So sort of, again, talking about how do we mitigate those effects of medical management, because this is a potent stressor, not only for our animals, but again, for our patients, we see the same. So some of the factors to really think about when you're thinking about our animals, again, are what is the sort of, how do we see the animal as a whole? So we have, the behavioral component of the animal, the psychological component of the animal, and of course the physiological component of the animal. All of the things that we're doing as investigators and again, people who are caregivers in this situation are influencing those 3 things, from the design of our model to the surgical interventions that we might impose on animals, certainly the handling and clinical care, and then of course restraint and social structure factors are all in there. So when we talk about disease modeling, again, we're coming back to this complex clinical management, substantial handling for our animals, especially in overt disease models. I, of course, think quite a lot about this with diabetes, because as you might imagine, I have yet to have a clinical patient who comes up and says, I really enjoy checking my blood sugar 20 times a day. I'm enjoying giving myself insulin multiple times per day. Again, this is all quite a lot of handling that's required, both in our patients and our animals. So frequent blood sampling, we have a lot of specialized diagnostic assays, could be imaging, could be, again, blood studies, drug administration, nutritional management, surgical interventions, physical exams, imaging, urinalysis, and in any case, most of our disease models will have some critical care ICU situation potential. And I think, again, as scientists, it's really important to remember that when we have elevated stress levels in our animals, They're not representative of normal function. They compromise our study. This introduces confounding in our results interpretation. And I think one of the things that when we don't acknowledge this, it really opens us up as scientists to criticism regarding the validity of these models. So when we talk about stress, I think it's really important, again, to understand good stress and bad stress. So again, eustress, our positive stress, something good comes from a stressor. It's kind of interesting because, again, when you think about life, it would be quite contrived to never be exposed to a stressor. So of course, we have to always think about the balance that we're in. So when we talk about good stressors, these are things that are really motivating. Like for me, I will tell you, I am extremely motivated, of course, to come and talk to you about all of this work, but I feel a little bit of stress because I'm unfamiliar perhaps with the LabRoots platform. And I'm getting a little off track maybe in my thinking for a moment. Will I figure out how to switch a slide? But I'm still excited, and I feel, well, we'll see how the rest of the talk goes, that it's within one's coping abilities, right? So distress is very different, though. This is a negative stress where you feel anxiety. It's a very unpleasant situation for most people, and generally you would describe it as outside of one's coping abilities. So, these are situations that are often outside of your control. Sometimes we talk about them as phobias. They can be in the context of internal situations, but a lot of it is internal perception, and this can be majorly distressing. I put a few pictures up because I think we've all experienced the sort of positive stress, whether it's a test or being super enthusiastic about being on a roller coaster, versus this sort of negative stress. And again, we see it quite a lot in medicine where we're imposing aversive situations on patients that they can't control. And some of the phobias, of course, that people are most familiar with, flying, spiders, those sorts of things. Underlying all this is the HPA axis, and I think what's really important, again, for people to remember, scientists to remember, is stress is, when you're not paying attention to it, is just a tremendous confounder on these studies. So for me, again, I work quite a lot with metabolism and immunity, and when we see distress, and in some cases, again, you're going to see this in a very fundamental way, and we'll talk a little bit about this, but we see that cortisol raises blood glucose. We see these high levels of cortisol reduce liver sensitivity to insulin and promote insulin resistance. When we're looking at various ways when we want to protect a graft, if we have animals under chronic stress, we see blocking in T-cell proliferation and suppression of inflammation. So this is sort of a potent variable that, when unmanaged, really alters the course of studies. So what we might see are stress-sensitive parameters being altered, both hematologic and metabolic. We certainly see an effect on nutrition, as I mentioned, an effect in typical immune function. And one of the things that I think is really powerful is that it may actually increase these adverse events that are not related to our investigational products. And then these are incorrectly attributed to the investigational product. I think it's sort of every investigator's nightmare to think that, again, something is moving into the clinic in an incorrect way. So we may underestimate safety or overestimate safety in these situations, and that's a real problem. For again, our caregivers, I think there's this sort of last component, and that's that we see altered behavior towards our caregivers. So when I was thinking about talking about environmental enrichment today, I think it would be sort of disingenuous to not talk about the ongoing debate, because there's certainly going to be a group of investigators that feels quite strongly about it in both regards. So one of the arguments that we see is that enriched housing really disrupts environmental standardization and compromises experimental validity. So just as much as I'm coming to you today and saying, I think this is an important consideration in any program to really improve validity, there's equally a number of folks that might disagree with that. And if this argument is correct, in both cases, you're going to see an impact on animal numbers. I think this is an interesting argument for a number of ways, because when we talk about experimental validity, and again, some of the problems that we see with reproducibility, a lot of that, again, is going to be for reasons that we talk about here. it's certainly a factor for our animals that when nothing is happening, every variable in the room suddenly becomes interesting and becomes a variable that you need to control in these barren environments. And so I think either situation introduces some discussion about animal numbers. And I think like anything that we do scientifically, we really have to look at it in context of the very specific scientific question that we're trying to answer. Most of our housing systems in the past, design has considered things like hygiene, economy, ergonomics, basic needs of the animals. And I think that knowing that conventional laboratory caging alters important natural behaviors, and there's been some beautiful work done by several groups on this, that it's time to start moving the dialogue forward from simply meeting basic needs of our animals to the more relevant discussion of the role of environmental complexity, and really how essential it is in enhancing welfare to improve this external validity during data collection. So when we look at environmental enrichment, we're looking at prevention of abnormal behaviors often, so such as stereotypies, repetitive motion, barbering that you see there on the right. We also can look at it in terms of social conflict. So how do we manage species in captivity? Certainly we can look at this as cover from threatening stimuli. So this can be very basic, from caretakers, from light, from sound, from noise. Particularly for those of us that are interested in metabolics, thermoregulation, these sorts of things are really critical when we think about environment, and of course sensory and motor deprivation. So one of the things that I think is interesting is even though you don't have abnormal behavior in some of these colonies, and I'm sure you'll see a question come up in Q&A is, well, what if I don't see abnormal behavior? Maybe everything is okay. So I think not only I should have maybe amended this slide to avoiding abnormal behavior, but also eliciting species typical behavior being critical. So again, sort of avoiding abnormal behavior is great, but you also should see an elicitation of species typical behavior as you design these programs. So the things that we look for, of course, are sensory and occupational enrichment. So these are things that I tried to give you a few examples: natural lighting, music, pools, playpens, paper shreds, these sorts of things. On the right, you see some of our cynomolgus macaques enjoying some bubbles and touching. And of course, behind them is the natural light of the University of Minnesota campus. And you can see this is in our very long winter phase. And below that, you see some of our feeding enrichment. So again, we're looking towards things like variation in diet, natural foraging, and food processing for our animals. And then, of course, enrichment devices. Furniture, things like swings, perches, also puzzles, toys, boxes, tubes, those sorts of things. And I think another barrier that we see with certain groups as they try to think about how to incorporate enrichment into their programs, of course, is it inexpensive? How safe is it? Can it be effective? So again, we're looking at how do we do these things: color, sight, sound, texture, structure, in a way that's really reasonable. And I put a few examples here of how we've become quite good at collecting cast-off materials to create enrichments for our non-human primates and for our rodents. At the top, of course, you're seeing something as simple as a very inexpensive dental envelope that's used with cast-off shredded paper that you might imagine gets generated naturally by the facility, and again, some treats to really encourage foraging behavior. Some different textures in terms of rope and materials and shapes. Down in the left, you see, of course, something as simple as a syringe rocket, which is usually a throwaway item that can be a really interesting enrichment, especially for non-human primates to explore. Even old Lixit bottles that have been damaged in some way can be turned into a puzzle feeder. A lot of what we're talking about here incorporates some aspect of feeding, which many investigators that I talk to, and especially in diabetes models, need to take care a little bit with what the nutritional management program looks like. And you see there that there's a number of extracts that you can use to, again, give some room to incorporate scent without actually having, again, an ingested item. And down on the right, of course, you see some creation of some piñatas from just your standard gloves in the facility. One of the things that I think is really key is you think through the different types of enrichment that you're going to use, and when you think about how to alter housing environments, is really what we're looking for often is introducing some control and choice in a situation. In particular with disease models where animals and humans have a limited amount of control over certain aspects of their life and their care, it's really important again that we talk about balancing that in other ways. So as you can see here, these are some examples in the rodent world of allowing for some of the things that we're really looking for. So we're looking for, again, exploration. We're looking for, especially in group house rodents, to really support affiliative interaction and reduce, in general, agonistic interactions between our animals. We want to have an opportunity to forage feed. And of course, you can see some pretty fantastic nests that our nude mice have built in terms of ability to thermoregulate. And also, I think a big piece that's often left is proper grooming. You saw on the last slide, this can certainly be with the conspecific, but there are also alternatives when we think about being able to elicit that behavior, but using different products, for example, rope or fleece or those sorts of things. So I think it's really important to come back to how this all plays into our scientific outcomes. And I really like this study that was done relatively recently and really showing the effect of temperature on glucose regulation in mice. And I think you see very clearly here that fasting glucose in untreated animals is affected simply by room temperature. And when you get into glucose tolerance, which we typically use to assess the various interventions that we're applying in animals, was really different when you start talking about altering the temperature. So again, when we think about how the environment that we expose our animals to, or the tools that we give them to manipulate their environment to where, again, would be normal for them, really plays a role in what we're ultimately going to put in front of an agency in terms of regulation. The other thing that I think is really key as we know that the majority of our animals, again, are socially housed is does the design of what we're proposing actually give opportunities for play and socialization, and in fact foster it? So you can see here with some of our non-human primates in play areas that what we're really looking for is making sure that there's climbing structures so that, again, we can ask our group members to manage their social interactions in a productive way by having different heights, different rest areas, areas that they can actually hide within, and really manage those social interactions. You see it also in our rats there on the right. You can see, again, different areas, different cover areas. These are all Lewis male rats, and so we want to make sure, again, that we're not introducing areas for resource guarding, and again, making sure that there's the ability to take cover if needed. So why does this matter? I introduced this, and I think, again, this is really important, and again will be up for debate, and I think we'll see considerable work in the literature forthcoming about this. When we have simple environments that we typically see with conventionally housed animals, we can really see some major confounding. When there's very little stimuli, of course, these small variations become very relevant all of a sudden and can infect animals in a really exaggerated way. Everything from perhaps the smell of cologne on someone walking in the room to, you know, a noise that happens in the room. And this, of course, we can see how this would obviously impact validity. Certainly when we talk about the social features of our animals, isolation, depression, all of these poor coping aspects really can factor in when we talk about immune dysregulation on outcomes. So infections, failure to thrive, in the transplant situation, graft survival. And I think we see this in the literature, that there's tremendous inconsistency between centers. And I think what you're seeing with that is the impact of the environment as a silent confounder. And I think, again, when we talk about reproducibility and holding these environments stable in conventionally housed animals, yes, you may reduce the number of animals used in early testing, but the fact that there's no reproducibility is a real problem, and certainly could impact some promising therapies that we're bringing to clinic. So as I mentioned, I think it's really important to think about shifting balance in how our animals experience their day. Each interaction that we have with them, their environment, it can really be thought of as making withdrawals and deposits. And how much or how little is in this bank will affect that behavior that you see. So as I mentioned, I think, there's not just behavior and enrichment, but also overall model design. So the consideration to eliminate multiple major survival surgeries where possible, or at least reduce invasiveness. Refinement of model design as a whole. This can be timing, instrumentation, how we induce disease and manage disease. But the things, that we're focusing on today really are that provision of opportunity to foster species-typical behavior, choice, and social interaction. And I think a big component of enrichment that's sometimes underappreciated as we focus on manipulata, food, those sorts of things, is this aspect of behavioral management or training for cooperation that really enables this advanced clinical care and predictable interaction that we need. I like to use the example of non-human primates because it's just so relevant again. So non-human primates are very stress sensitive, as most of you probably know, and this really manifests in measurable changes in physiologic parameters. I put up on the side there glucose glucose levels from a paper from 2013. These are rhesus 2 and 3-year-old males and females, and this is their blood glucose levels under stress and after they've been accustomed to handling. 30 milligrams per deciliter change in blood glucose is pretty remarkable and could probably tell you that this could be the difference between having a therapeutic pass or fail as it goes into our patients. So as we talked about, this has a real potential to underestimate the treatment value if you have glucose that continues to be elevated related to stress. Or you certainly have in the safety component that where you have these adverse events that may not actually be related to the investigational products. This is also really nice work that I like. This is a really nice example of how stress impairs oral glucose tolerance. So these are, again, cynomolgus monkeys that have been accustomed to chair restraint. You see that in the square, or I'm sorry, you see that in the circle, or you can see in the square animals that have been accustomed to squeeze back conventional restraint. And for those of you that haven't had a chance to see oral glucose tolerance before, what's really kind of interesting about this is that these are normal, healthy cynomolgus macaques, and you should see a return to baseline in 2 hours. And you can see even with a very nice training program where the animals have been accustomed to chair restraint, you see that their oral glucose tolerance is still impaired. Now the animals that have been acclimated to squeeze back restraint, so they're still in restraint, actually come closer to normal at 2 hours. And I think this is really interesting because I think it really speaks to the social component for our animals, and that even under squeeze back restraint with all of their cohort around them, they have a more normal response anyways to glucose. And again, a reminder to the group that responses to glucose and insulin are major outcome measures in transplantation. So when you look at this and you see how handling alone can really impose some major changes before you even initiate treatment, I think this should raise a level of concern for all of us. So this is in our own program here at the University of Minnesota. So we train our animals to cooperate with medical procedures related to their diabetes management and also, of course, metabolic testing. And I think what's really interesting is we took a look at historical controls in our program where we use chemical sedation versus animals that were trained for cooperation. And again, you can really see this happens to be intravenous glucose tolerance testing, but the glucose peak is much higher in animals who are cooperating, and the disappearance rate is actually significantly higher than animals that were sedated with ketamine. So again, no treatment has been imposed on these animals, normal, healthy macaques. You really see the difference alone that handling introduces for these animals. And again, I put a couple of other things up here for our animals who are cooperating. So you can see C-peptide, which is a marker of insulin secretion in animals that are cooperating. Very, very normal, very tight around the data point in response to arginine challenge. And one of the things that I think is really, really cool is when you start adding these features that again mimic the clinical patient situation, you can start doing things like it's done in the clinic. So when you're not sedating animals, for example, to do tolerance testing, you can do a mixed meal. So you can feed a meal. You can come back to the animal 90 minutes later and have a look at them just like our patients. So behavioral management, I think, is a really key component in terms of enrichment and thinking about your enrichment program. Training, as we know, really reduces the amount of stress that our animals endure during our base interactions with our team, and that could be anything from husbandry to actual clinical care. And training is a real process for our animals to learn. So you have this cognitive stimulation component and can actually be very enriching to our animals. For those of you that manage facilities, manage people, I think it shouldn't be underestimated the relationship that develops in animals who are trained, and really improvement of technician attitude, interactions. Occupational health perspective, you're going to see a reduction in exposure, scratch bites, and needle stick injuries. And of course, as we've kind of talked about throughout, is that stressed animals do not yield reliable data. So of course, we really have that at the core of why we think about these things. So our philosophy is to really train useful behaviors for our animals in the context of adaptive or constructive coping strategies. I can't tell you as an investigator everything that our animals are going to see during a study. There might be, in terms of behaviors that we might need. We know there's some basics, but what we're really looking for, again, is to make sure that our animals can cope with everything that comes their way during study. Much like our clinical patients, we're looking to establish flow or a positive welfare state and really balance between those positive and negative experiences. And again, we always have to remind ourselves that transient stressors are not unequivocally detrimental. It's normal. It would be quite contrived to have an environment where there's no stimuli, and it would be a real problem in that regard as well. But again, we're always looking for that balance. So we take some lessons from the pediatric situation. Behavioral conditioning is also used in young children, especially when we're asking them to perform painful or fear-inducing tasks without sedation. And I think it's really fascinating to look at the triggers in kids because, again, they're very similar to what you might expect when you work with your animals. So meeting strangers is a big thing. Separation from parents, inserts, of course, separation from group or separation from herd or separation from colony there. You can imagine how that has a nice parallel. Exposure to sights and sounds of equipment. Certainly that's really key, especially in the prey species used in research. And of course, association with previous painful medical procedure. So what we really look to for our program is to adapt techniques that are used in difficult PED settings and established operant conditioning methods. One of the things I think that is really important to think about as you design your behavioral management program is to think about positive reinforcement. Why is it so important as you work in your training programs? For our patients, you think about sort of, again, in the disease state, what they typically manage, fatigue, intense treatment schedules, med side effects. Again, you can make that nice parallel to our animals with welfare. But I think really coming back to the science is critical. So we know that, at least in transplantation, which I use as my example here, that we will have risk for a poor transplant outcome if we have patients with avoidant coping strategy, patients who are non-compliant, and patients with a lack of social support. Now, typically in the preclinical phase, that's not what people are interested in studying. They're interested in looking at the intervention. So we want to make sure we remove any of those factors that might influence outcome. So when we talk about our caregivers, I think it's really important, especially as many of us think about sort of this culture of care and how we foster a culture of care, to take a look at our training of our personnel, how we look at competence, and again, how we develop our people professionally. And a big piece of that is developing this rapport between our caregivers and our animals. So I think of this a little bit as a cycle, and I think it needs to be really thought about in a stepwise way. So our caregivers really need to be linked with positive experience outside of research, and this can be done in a number of ways. But again, these are a commitment to time, so that again, there's not something that's just linked with that research procedure. It's really critical to establish some level of routine through a continuity of experiences. So familiar people, things that they can predict, all of those sorts of aspects, so that there's some things during the day that have a standard routine. Very important to ensure our caregivers are skilled with the medical procedures that we have planned and are expert in that. Most of us deal with a degree of teaching, and so ways to do that, I think, are really key, whether that's, again, similar to what we do with again, our medical veterinary students, where we allow sort of low risk, where we do cadaver training, where we do model training, all of those sorts of things, so that by the time, again, you're working with your animals, you have a certain degree of skill and expert technique. And of course, it's incredibly important to give our animals sufficient practice in these low stress situations so that they have opportunities for success. Particularly in induced disease models, animals can really be qualified to see, are they ready for all the rigors of care. So I think this is really critical, that, again, you make sure that you have all those skills so that when it really counts, when the animal needs them, they're there. And that's going to get you to the point where you have a situation of trust. And when we see that trust, whether it's in our human patients or our animal patients, we see a lowered level of anxiety, anticipation towards reward. And I think probably who's done it best is the dentists have really looked at this decreased perception of pain in response to pain. So of course, if you go into a procedure, I should have added that to my phobia slide, since many people, of course, are really concerned about going to the dentist, and you say, yes, I think I'm going to have a very high pain score. I'm really concerned about this procedure. That perception going in, those patients actually do have higher pain scores, of course, versus those who understand the procedure, understand what they might be subjected to, and really have a good understanding of this. In disease models, you get a sort of added bonus, is that there's an intrinsic reinforcer. So when we work with our animals and we're giving care to our animals, they actually feel better as a result of a successful therapeutic intervention. And so that's a nice intrinsic reinforcer. And then, of course, at the end, you have successful coping. So some of our goals that we've had, of course, are to reduce or eliminate use of restraint at all in our routine medical interventions. We want our animals to do all of their trained behaviors, if possible, in the home environment with social support. And of course, we're looking to increase affiliative behaviors between our animals and our caregivers so that we have that trust relationship and familiarity. So you see there on the top left, this is a cynomolgus macaque doing some touch with a handler. So again, getting some really good interaction, along with down on the lower left, you'll see again one of our macaques who's just touching, getting a food treat from one of the handlers. And again, that's to create a really reward-focused environment. And again, what we're looking to is to diminish the perception of pain related to disease management. So how do we do this? We use desensitization and counter-conditioning. We train quite a few foundational behaviors, probably the most important being hand feeding and drinking. We're often looking for preference with our animals, and we want to reestablish that preference as it happens. We want to understand the base temperament, personality of our animals. And this can be incredibly useful for med administration. We use it for measured rehydration therapy, metabolic testing, and we take a look at evaluating the development of nausea or apprehension during our high-risk drug administration. And this is kind of a really neat feature. Again, if you're working with animals under sedation, or you're working with them in restraint, you're not going to sort of, again, see the typical reaction, because they may be reacting to restraint, or certainly not at all under sedation, as you would in an animal who's fully cooperating with the handler and has a sudden behavioral change. So there's some really special considerations, again, when we talk about disease models. When we're having a medical procedure that's necessary, it's very different because we don't have a proper choice condition. For example, in a diabetic rodent or macaque or baboon, you certainly don't have a choice whether or not, again, you can go without insulin. These things often occur frequently for our animals. They are intrinsically aversive. As we talked about, when you're fearful or anxious, this amplifies the perception of pain. So it's really critical as you're working with animals who are under the disease condition, no matter what you take away from this talk, that their outcome or following whatever interaction you have with them needs to be favorable. So they need to interpret that that interaction with you was favorable for them. This is another behavior that's incredibly useful for in particular for macaques and baboons. So this is shifting. We move animals from one lab context to another, and you can see, of course, that's done via primicarrier in this example, or a transport cage, as you see with the baboon. You can use this for weights, oxygen therapy, heat therapy, all very important things, again, when you may have an animal who's been compromised because of a disease state. Not wanting to compromise them further with restraint or sedation is really key. This is also very useful, of course, for routine husbandry, moving our animals to specially enriched environments, proximity testing. So when you want to take a look at how an animal is interacting with conspecifics in the room, you can do that in a very protected way. I did put, of course, a note here when you see, of course, macaques and many of our animals can work in pairs. So you see also that social support component. And again, thinking about that as you design how you do and what you do. This is an example of our cooperation with handling. So again, what we're asking are, whether it's a rodent or a non-human primate, we're asking them to work with us without being in restraint. So you see, of course, a macaque who's presenting a limb for a blood glucose in the first picture. You can see one of our nude mice who's walking freely around while having a tail stick blood glucose. And you see, of course, one of our smaller macaques who's trying for the first time actually to practice physical examination. So he's presenting up for handler, no squeeze back for any of these animals, and sitting with the handler and really trying something new for this animal, which is fantastic. So we use this, of course, for injections. You can do very simple physical exams and vitals. You can collect urine in this way. This is certainly things that you can do to do blood collection via heel stick, tail stick, catheter stick. We use vascular access ports as well. And this allows you to really do some extended conscious metabolic testing, which is, again, like what we would do in patients. And, of course, hydration assessments. Reward schedules and anticipatory behavior are really important. So as you think about how you're doing behavioral training, the reward timing and type needs to be adjusted towards your behavioral goal. So for our animals, we do quite a lot of early phase high frequency rewarding, lots of jackpots. But as our animals acquire these skills, the reward type and frequency is going to be altered. So in particular in diabetic research, a lot of what we're doing is under fasting conditions. So we need to rely on other aspects than just a food reward, which I think is what people think quite often. As they think about positive reinforcement training, they always go straight in their mind to, well, I can only do this if I have a food reward. You see on the left there, these are two female cynomolgus macaques. The animal that's working, who's getting fluids in that picture, is very motivated by social partnerships, so that's rewarding. So the work that she's doing is being rewarded in that way. The baboon in the middle is doing some target training and was rewarded with moving into an area with an item that was really important to this animal. Happens to be a perch swing that they really favored. And of course, it's a go-to, so look to favorable food and drink for our animals. This animal that's having a high-risk drug infusion is enjoying a treat. The hierarchy that you typically will see is, for many groups anyways, is taking a look to yourself first. So desensitizing animals to caregivers initially, and then looking towards the equipment that they're going to encounter, touching, and then going into medical skills that in this case I've given medical skills that are relevant to us as we work in diabetes models. And you can again see this macaque on the right side of your screen that is very, again, able to participate in their care. So having a look to what we're doing, we've moved the instrumentation in a way that, again, he's able to present, and he's able to have some control or choice over how he presents, and these sorts of things that I think, again, are really fundamental to having this relationship where you can have an animal who's up and touching and grooming handlers and doing the things that they need to do to be successful. So often a question that comes up with behavioral training or behavioral management is how long does this take? And the time investment that we typically see in our unit, especially for macaques, is about 10 to 12 hours in total. We spread that out over 2 to 3 months, and we do it as a session base. I think what's pretty remarkable, though, is the majority of animals. We typically see efficacy through the entire training regimen of over 90%, and it is pretty remarkable. So again, you can completely eliminate restraint from a program. In our case, we eliminated chemical and chair restraints in favor of cooperation. And I really like to share this figure because I think it's quite telling that with restraint, our incidence per study days of handling animals and using restraint was actually much higher than cooperation, because when animals are cooperating, we generally are able to accomplish what we aim to do and reduce our overall interactions with our animals. So reduce the number of times that we have hands-on animals or disrupt their day or remove them. So this allows our animals to go back to what they'd rather be doing outside of research procedures. Really important feature of the work, I think, is that for us, we see in a very objective way that behavioral management and enrichment reduces our model-induced confounding. So what we looked at was historical animals versus our animals that had been cooperatively trained. We looked at similar immunosuppression, and we saw quite a different picture in the thymus. So again, something quite objective, that despite profound chemical immunosuppression, we were able to see a normal thymus. So we took this as a mark that there was coping strategies that were established. So even in a very novel situation, our animals had some basic experience with handling, to the extent that they perceive contact with handlers as rewarding. And this makes any sort of interaction that we have, even if we come up with something new that the animal has to do, less anxiety inducing. And we observe this as very durable. So we believe, of course, that refinement has been very critical to our program, both our science and our animals. And I think I would go so far to say that this really makes possible the life-changing therapies that we're all aiming towards for our patients. We see that stress can be minimized by giving animals training to engage with their care and enrichment opportunities to exert control over their environment. A big and important feature for the investigator is the ability to capture data from each of these individual animals is maximized. So it reduces our overall number of animals that we use in research. And I think something very exciting for us is that we've seen a significant improvement in diabetes and transplant management, along with instrumentation that we've done, which has opened up new opportunities for scientific evaluation for us. Once we take out the confounding that we see induced by these stress variables, we are able to look at different therapeutic strategies properly and really evaluate them in a very fair way. So I have a large team here to acknowledge that does all this great work with our animals. And now I'm ready to open it up for questions.
Thank you, Dr. Graham, for that informative presentation. Now it's time for Q&A. If you have any questions you'd like to ask Dr. Graham, please do so now. Just click on the green Q&A button at the lower left of the presentation window. Type your question into the box that appears on the screen and click the send button. We will answer as many questions that we have time for. Now let's get started. Okay, Dr. Graham, your first question. Do you think negative or positive experiences in the environment prior to shipping to an investigator's institution impact their experimental outcomes?
Well, I think this is a brilliant question for whoever asked this, and I think I hope that everyone that's been enjoying this Lab Roots talk today gives a little bit of thought to how their actions impact their colleagues' use on animals. I think the answer is unequivocally yes. So again, animals have quite a long memory for experiences that they've had. So if they've been exposed to stimuli that they perceive as aversive, and develop associations with that, it can absolutely impact behavior and overall experience that they're going to have ongoing. And in fact, many behavioral managers will be spending their time in that case possibly extinguishing behaviors that are associated with negative experiences that they might have had. Now, conversely, certainly groups that are supplying animals and are going through the work of making sure that this positive component is there, and I think there's so many groups that are really giving quite a lot of attention to that. You really see how this benefits investigators, because again, animals' entry into study, because of that really wonderful basis, is really enhanced. So I think that it absolutely plays a role and should be something that most groups are considering in terms of how and where they source animals.
Next question. Have any of your studies involved the training of African green monkeys? If so, what was the timeline for training them for procedures?
Great question. I have not used African green monkeys. I think, again, I would take probably the perspective that having trained both cynomolgus macaques, rhesus macaques, and baboons primarily, and of course rodents, I think you're going to see that the training time is somewhat similar, depending on what you're asking them to do, but similar to our procedures that we did in macaques. I think you're going to see a ramp-up time that generally mimics the quarantine process. Most groups are quarantining for 45 to 60 days, and that's usually sufficient time for most non-human primates to be trained with fundamental basics.
Next question. An audience member says, I love how you trained the NHP to do procedures without using any chemical restraint. How long typically does it take to train them for injections and blood collection?
So I really love this question because we published this in the Journal of Medical Primatology, and really it is an average, probably total time investment of between 10 and 12 hours. Now this depends a little bit on the trainers, because it's equally important to train the trainers as it is to train the non-human primates, of course. But we do see differences, right? So you want to kind of consider that your animals, your pool of incoming monkeys will be a bit on the spectrum, much like people. So sort of high training IQ to maybe low training IQ. And a number of my colleagues have put together some beautiful papers on temperament. And all of these things affect how the individual speed goes through in terms of training. But I think you can feel quite confident that your time investment of again about 10 to 12 hours is fairly accurate for most macaques and baboons to acquire the basic procedure to say, yes, I'm going to present, and again for blood collection.
Dr. Graham, how can you measure the success of an enrichment?
So I think this is something that we always need to look at. And again, when we talk about the enrichment argument, I could have added this to the list. I think a lot of folks think that enrichment isn't valuable or useful. And I think that it's quite important for everyone who's managing enrichment programs to really look at quantifying the value of enrichment. So for example, you might look at time spent with the enrichment, the behavior that the enrichment elicits. Is it a productive behavior? Or again, we've all seen cases of sort of enrichment gone wrong, where someone has thought, yes, this will be great, and it actually elicits a negative reaction. And I think, again, durability of that behavior. So is the enrichment useful for 5 seconds, or is it something that you can continually give the animal access to and will continue to elicit that productive behavior? I think in social situations, you have to look at the enrichment in the context of promotion of affiliative behaviors, or, again, does that enrichment actually increase social tension? That's a really big problem in terms of resource guarding or competition. I think practically, or when we look pragmatically again, we need to look at the safety of the enrichment, the ability of the team to maintain it. And I think we need to, again, as scientists, always look at, did this enrichment bring the model closer to the clinical situation? When we talk about, again, in diabetes, I like to look at, does avoiding that restraint variable via blood collection, for example, bring it closer to my clinical patient? And the answer is yes. It would be very extreme for us to, for example, sedate a clinical patient to take a weight, or to do something as simple as the blood glucose, or repeat frequent stimulated IVGTT. These sorts of things would be very unconventional to sedate a patient. It's gene therapy on boards. Another thing we know with restraint is that you will elevate serum CK levels. For people who are transfecting muscle, for example, that would be a tremendous confounder to have to work with these animals in restraint. And I think ultimately you can manage this through reporting the conditions that the animals are exposed to. And that's sort of the basis for the ARRIVE guidelines. When we talk about the debate that comes up with enrichment, and people are concerned about adding variability, that again can be disclosed. And the absence of enrichment is a variable as equal to the inclusion of it, and should be reported and considered as we look at the study.
Thank you, Dr. Graham. We have great questions coming in. Next question, do you have a dedicated training team to work with these animals initially, or do the investigators actually doing the procedures perform the acclimation training?
This is a really great question. We have kind of a mixed model. So in our situation, we do have a team that's very skilled, and as I said, trained trainers that are dedicated to moving the animals through phase training. Some of them, again, are going to work with these animals again. Others may exit and go to a different unit. That team is always, again, though, at the core of helping whoever is going to work with those animals to understand how to use the right cues, how to reward in a way that's meaningful, documenting preference, having a look at temperament, all of those sorts of things, so that, again, if they aren't ultimately the folks that work with them, that the animals are prepared in a certain way. Because we can't always control who might be interacting with our animals, we make sure, too, that our training phase includes an actual step where they're introduced to different people that they haven't met, and that the behavior can still be elicited. So I think that's a really important question, both from the practical perspective of many groups don't have a dedicated training group. I'm very fortunate that I do have a dedicated group of people who train.
Dr. Graham, how would you approach water restriction paradigms with mice?
So it's such a great group of questions. I really like this question because I think I would have to understand the context of the science that this question was being asked, because I generally think it's a little bit difficult when you start discussing water restriction paradigms, because you have an animal that starts at a negative balance. And behaviorally, that has consequences in terms of motivation. So I think it's really pretty critical, if asking in the context of water-restricted animals and how you might still enrich them. I think there's certainly a number of aspects in terms of choice and control, again, that you can still give these animals. When I was showing those pictures of nesting or enriched areas for our macaques, a lot of what we're looking for is to allow the animals to reconfigure their environment or exercise a level of control and choice, because they may be limited in other aspects. So if that's the basis of the question, I think there's a number of enrichments that can step around the fact that the animals can't be on free water. But in terms of using water restriction as a behavioral motivator, I think that really has to be in the context of the scientific question, because it comes with a lot of limitations when it's selected.
For enrichment for rodents, are you able to autoclave certain paper products that you are able to recycle from home without turning them into mush?
Yeah, this is another great practical question. So I think this is something we absolutely do. We've become, I think, quite good at determining what we can autoclave and what we can't. We've come up with some interesting plastic structures that have made their way through our autoclave. But yes, I encourage everyone to take a look at, going through different tests about how you can sanitize properly for introducing things that you have anyways around. Our experience with autoclaving paper has been successful.
This has been a great question and answer session, but we're almost out of time and we have time for one more. How about rodent bred diseases on pharmacological studies? Diabetic rodents are already stressed, so how do you enrich the process?
Yeah, I think this is a brilliant point that was made by the person answering this question, and I think really fundamentally appreciating the challenges that come along with disease models. I mean, in particular, as you mentioned, diabetic rodents are stressed, so you want to really take care that you don't add on to that stress. Certainly with handling, in particular, diabetic rodents are also equivalently stress sensitive in handling, so that as you are able to manage their disease better, which most studies aim to do as part of the handling, that the handling itself doesn't mitigate any effect that you're bringing with the therapeutic intervention. And so I think that's really critical. I mean, again, for diabetic rodents, I think thermoregulation is an incredibly important and underappreciated aspect of managing their care. You certainly don't want to add thermal stress on top of issues with glycemic control. And again, I think that when you talk about these various diabetic rodent models, you again have to look at housing conditions, any sort of resource guarding, things like that, that might add additional stress to these animals. So all of these factors you need to consider, and some of them are going to be strain dependent, no question. So I think this is really valuable to ask that, and I think that going through and looking at kind of the three key areas, their housing conditions, their social perspective, and the clinical care that you can give, and targeting each of those is really a way to best reduce that stress.
I would like to thank Dr. Melanie Graham for her presentation today, and I would also like to thank our audience for their participation. Dr. Graham, do you have any final comments for our audience?
Well, I want to thank everyone for watching. It was some really brilliant questions, and I look forward to having any of you who are interested in continuing the conversation reach out. Thank you so much, Christina, for doing such an excellent job in moderating.
And thank you once again, Dr. Graham. Now, before we go, I want to let everyone know that today's webcast will be available for on-demand viewing through May 9th, 2017. You will receive an email from LabRoots letting you know when this webcast will be available for replay. Please share that announcement with your colleagues who may have missed today's live event. That's all for now. We thank you for joining us and hope to see you again soon. Goodbye.